All right, so this is Steve Ebers. Today we're going to go over how to write delayed orders. So when you would write delayed orders would be if you have a patient that you know is coming into the hospital, but they're not here yet, but you want to go ahead and get a start on their admission orders. So maybe they're coming from clinic or another hospital or something like that, and you just want to get things in place so that they're activated as soon as they get here. So I have a page open right now that shows one of our test patients. First thing that you're going to do is you're going to go to this Write Delayed Orders button up here. Click on that, and then you're going to do delayed orders until admit to medicine, since they're going to be coming to our team. You'll notice that if you're going to admit them to observation, you'll do it under that separate button for admit to medical observation. But if we click on admit to medicine, hit OK. So you'll get this new screen that'll show you that these orders will be delayed until you get that admit to medicine order active. So under treating specialty, you'll put general acute medicine. For location, you've got Omaha VA Medical Center, and then you can type in your attending, which for this example, I'll just use myself. All right, so you put accept. After that, it'll allow you to go through all the orders that are already in place on this patient to choose if there's any that you want to carry over into the inpatient setting. So for example, if there had been a lab that was ordered as an outpatient that you want them to collect once the patient gets here, you can highlight those or potentially highlight multiple of them and make sure that they're carried over when the patient actually gets here. So in this case, maybe we want this thyroid panel to be collected as soon as they get to the floor. After that, and you hit OK, you're going to be taken to this screen, which is going to be similar to what we're going to do for all our inpatient admissions. And so you'll just click on Admit to Medicine Acute Care. And then it's going to walk you through the admission order set like you would normally do on any patient. Next, we're going to go through how to go through the admission order set. So you're going to find your admission order set off to the left here under orders labeled admission order set. So click on that. Once you do, you're going to have this screen pop up that's going to start off with instructions on how to put in a life-sustaining treatment note. I won't read off everything right now, but you'll see instructions about when you should use one, when you should not use one, when you should look for an old one. And so you go through all those and determine what you need to do with the life-sustaining treatment note. Once you're finished with that, you'll hit done. And next, that'll take you to the screen that'll show your admission orders. You'll have options up at the top here for different types of medicine admissions, including acute admissions and then also admissions to observation or hospice or COPD. For this one, you use acute medicine admission orders. On this next screen, you'll see our sepsis screening criteria. This is intended to make us stop and pause and think about if the patient is being admitted for sepsis. And so you'll just go through each of these criteria and see if you feel that your patient meets two of the following out of letter A here, and then also suspected infection. And if so, then you'll click on yes, that they meet sepsis criteria, or if not, you'll click on no, they do not meet sepsis criteria. All right, so that'll take you to the next screen. And once again, if you look over to the right here, you'll have this checklist of all the things the admission order set is going to go through if you want to keep track of where you are. So first, you'll pick a diet order. And so if you click under common diet orders, you can pick a regular diet or any restricted diet, however you might need. All right, so after you either choose a diet order or if they already have one, you can hit next. The next one will take you to telemetry. You can decide if your patient needs to be on telemetry. You can also order an EKG from this screen. Next, you'll choose what you want for vitals. And at any time that you click on something, a new order will show up and you'll have to accept that order separately. Going to the next screen, you'll have the notify physician settings. So this is important to update before the patient's admitted so that the nurses know when to call you. So if you click on that, it'll have some pre-populated parameters here that you can change however you need to. On the next screen, it'll ask you to add any allergies that the patient might have. So if you interviewed the patient and learned that they had an allergy that wasn't listed, you have the opportunity to add it here. So for example, if we search latex, you'll be able to choose from this list to add to the patient's allergy list. When you add an allergy, it'll ask you to add the signs and symptoms that the patient has when they're exposed to that allergen. All right, after the allergies tab, you'll have a nursing cares and treatments tab. And so here's where you can order a lot of different nursing cares like glucose checks or instructions for intravascular lines or wound care instructions. You can also order a sitter from this page. On the next page, you'll have activity orders. It'll give you some instructions on following our MOVE criteria to determine if a patient's appropriate for general activity or if they need a modification. And on the next screen, it'll just verify that you've looked at those and understand the criteria. After that, we have a page for venous thromboembolism prophylaxis. So it'll give you some options based on if a patient has a contraindication to thromboembolism prophylaxis or if they have a reason why they don't require pharmacologic prophylaxis. So examples being if they're already on anticoagulation or if they have a CNS bleed, that's why you might not order it. If they have no contraindication to anticoagulation, you'll click down here. And then it'll ask you about the patient's creatinine clearance. If you click this button on the top, it'll automatically bring up the patient's last creatinine clearance just to make sure that you understand what you're dosing it off of. It'll also ask you about the patient's BMI. If you have a patient with a high BMI, then that might prompt you to choose a different medication. If neither of those apply, then you'll click here to continue, and then you'll be able to choose your medication for prophylaxis. So in this case, we'll use Lovenox. It'll also prompt you to put in an activity order to get the patient up and move them around. Moving on from there, on the next page, you can order a physical therapy or an occupational therapy consult. And if you open up the consult order, it'll give you some prompts here to type in the reason for the consult and the clinical indications. On the next page, you'll see orders for respiratory support or oxygen, ranging from low flow nasal cannula to some of our more invasive or positive pressure ventilation. On the page after that, we have a dedicated page to community-acquired pneumonia to help prompt you on antibiotic orders and then also making sure that things like blood cultures are drawn prior to giving antibiotics. If you have a patient that does not have a pneumonia, then you can just click on from this page. After that, there's a page for ordering medications. So if you look off to the left, there's common categories of medications that you might order on inpatients. So you can click on any one of those and then they'll prompt you down to other more specific choices. After medications, you can order labs. So you can order them to be collected the following morning, or you can order them to be collected whenever the lab's coming by next. Or if you have an urgent need for a lab, you can order them stat or at a particular time. On the next page, you'll have orders for imaging studies. And so once again, like on the other pages, you can click on the general type of study that you want, and that'll prompt you for more specific types of studies. And then after that, you have the option to order consults. And so if you need to consult a medical or surgical subspecialty or others, you can order that from this screen. On the next page, it'll automatically prompt you to see if you want to order an EKG. If you don't want one, you can hit quit. Otherwise, you can order that at this screen. When you're happy with all the orders that you have, you can go ahead and hit done. And then all your new orders will show up in blue here on your main order screen. You can either highlight them individually or together, or you can go to refresh patient information, and then you can sign them all at one time. Those will all become active once the patient's admitted to the floor. If for some reason they're not active when the patient arrives on the floor, you can also release them manually by highlighting them, and then you'll right-click and click Release Delayed Orders. I would warn everybody that if you go through the refresh route, that it'll sign any unfinished notes that you have too.